Hello everyone, I'm Dr. Darsh Shah.
And I'm Dr. Altamash Raja.
And welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare. As a medical professional, you should be focused on fixing people's lives. But as a key decision maker in your practice, you have to figure out how to grow your patient volume, keep up with reviews, and how to stay connected on social. You don't have time for that. You went to med school, not marketing school. Good news, your team at Advice Media did. Their pyramid of success was created for professionals just like you. The pyramid has 6 stages that, when combined, creates the ideal digital presence. Give them just 30 minutes to consult with you. We would bet you are doing some things really well. And there might be areas where you can improve. Just for spending the time, they'll give you a $60 Amazon gift card. Don't delay your booking now. Go to drpodcastnetwork.com/advice media. That's drpodcastnetwork.com/advice media. This week's guest is Dr. Micah Yu, a board-certified rheumatologist and lifestyle medicine doctor out of Newport Beach, California. Dr. Yu is also training to become board-certified in integrative medicine and certified in functional medicine. And soon enough, he will have the trifecta. In this episode, we dive right into all things integrative rheumatology. Now, a lot of us know that rheumatology involves the immune system, and along with that comes a plethora of medications. But in this episode, we discuss what might be driving what Dr. Yu calls this invisible disease. It's a fascinating episode, especially with so much information coming out at this time with COVID and autoimmunity.
All right, guys, welcome back to another episode. Today we have Dr. Micah Yu. Dr. Yu, or Micah, I should say. How you doing, man?
Good. How are you doing, Altamash?
I'm good. Excited to have this conversation. I know we've been following you on social media for a while. You're putting out some great content, and I definitely want to pick your brain a little bit. I know we're limited on time, so we're going to get right to it. So, for those of our listeners who don't know what you're all about, maybe even what your specialty is, because I feel like it's not one of the ones that's talked about so much. Not one of the quote unquote sexy ones. So, tell us a little bit about your journey, who you are, and what brought you into wellness and medicine.
Yeah, so I'm Dr. Micah Yu. I'm a rheumatologist. So basically, that's a field that specializes in autoimmune disease of the connective tissue and also arthritis. My journey to this specialty really started back in high school. I got diagnosed with gout at the early age of 17. And then that disease pretty much transformed over the years to multi-joint arthritis. And it was unexplained by different rheumatologists. No one could really figure out what was going on. I saw different rheumatologists, different doctors, had pain in my TMJs, wrists, fingers, toes, knees, everywhere. And this happened during medical school. I mean, there were periods where I couldn't really eat, kind of over my TMJs. So finally, during residency, I saw the rheumatologist at my program, and they finally diagnosed me with spondyloarthritis, which is an autoimmune arthritis. So if you guys have heard of ankylosing spondylitis, I pretty much have that disease without the back pain. So I have peripheral spondyloarthritis. And what got me down this integrative route is really I went plant-based at the end of my residency. I was so sick and tired of the pain. I didn't take any medications yet. I was recommended to take meds such as methotrexate, but I refused. And within 3 months of going plant-based, my joint pains pretty much went away. My ESR, which is an inflammatory marker, went negative after 10 years of being positive. And my most recent lab work, my CRP is actually negative now, actually after being positive for over 10 years. So actually, no, my CRP went down first, and then my ESR finally went down. So it's been quite a journey. I still get pain, like very, very rarely. If I get super stressed, if I eat too much processed food, the pain does come back. But like 1 out of 10 pain, it goes away within a day. So nothing major. So I don't take any consistent supplements. I don't take any medications for this. I just try to eat clean, stay healthy. But that's where I'm at. I'm doing my second fellowship now in integrative medicine at University of Arizona. I'm also learning about functional medicine. So I'm really trying to combine all these fields with rheumatology, and I'm also certifying lifestyle medicine as well. So trying to just be a pioneer in this space, trying to be a voice for all these patients with autoimmune disease out there.
I love that. Yeah. I mean, I usually find that most of us who are so passionate and so driven to kind of be a voice, we are always connected, right? And that's, I think, so important because it really gives us that compassion, right? We always talk about this concept of empathy, which again, it can be acquired over time, and there's multiple ways to, and it usually comes easier to those who've had some personal struggle, I find. And you've obviously described that for greater than a decade. Two quick questions for you on just your journey. You said that every now and then you still get some aches and pains. So what kind of, like, where in the joints will you get it? Will it be knees, ankles, and what kind of functional limitations do you have with that, if any? And then
Yeah.
the other question, you mentioned plant-based. Like, what does that mean exactly?
Yeah. So going off the first question, the pain sometimes would be just the fingers or the wrists, or the foot. But it's nothing. It doesn't really limit me functionally. So I mean, it goes away within a day. Sometimes it's fast, or I just try to avoid all that processed junk. That's the main
Mm-hmm.
thing. And I work overnights. I work one night a week as a nocturnist.
Mm,
So sometimes that would, and I go straight into my rheumatology practice. I work outside one day a week at a county hospital too. So I work 20 hours straight. So sometimes that would hurt a little bit, but other than that, sometimes I forget that I have this disease.
mm.
So that's how minimal it that comes back. And then as far as plant based is concerned, so I um, I eat a lot of greens, a lot of fruits and vegetables. I try to avoid as many animal products as I can. I haven't eaten any animal meat within the past, I don't know, 3 years since I started. So lots of fruits and vegetables, spices. Just I try to go as vegan as much as I can. Of course,
Gotcha.
sometimes you eat dairy, sometimes you can't avoid it.
Hmm.
But I try to limit that. Fish once in a blue moon, but other than that, it's pretty much 99% vegan. I don't eat any animal products at home.
Yeah, and the other quick thing worth noting is, when most of us in medical school learn about AS, right? It's kind of that the spine, right? That's the buzzword. That's what's on our board examinations. What? How is it rare, or is it common to have a more manifestation in peripheral joints versus spine? Like, I mean, you're clearly in the minority there, right? And if so, like, what percentage of the population will have those type of symptoms, peripheral joint, and not have any issues with the spine?
Oh, yeah, great question. I don't have a number or percent. I don't know if that data is out there. But I mean, in my practice, I've seen AS in the back with the peripheral.
Gotcha.
You usually see it with the enthesitis. You guys learned that. So for those of you that are listening, and the enthesitis is what it is pretty much you have entheses, which are your connection between your tendons and your bones. That
Hmm.
little connection there that can get inflamed, even in sports. Tennis elbow, golfer's elbow.
Yeah.
That sometimes it's called enthesitis, but you can have an autoimmune component to that, which you get with ankylosing spondylitis and the spondyloarthritis family. So I do see patients with the joint pain in the extremities along with the back pain. That can be pretty frequent as well. Usually it does manifest solely in the back, but sometimes it spreads to everywhere else.
Gotcha.
Yeah, so I would say my own disease is more rare. That's why it took me a while to get diagnosed.
Mm,
Because usually you see with back pain, right? But there are several types of spondyloarthritis. There's ankylosing spondylitis, which you guys know already. There is peripheral spondyloarthritis, which is pretty much in the extremities without the back pain, and then you have undifferentiated spondyloarthritis as well. So they're very, very minute details, but the treatment's pretty much
yeah.
the same.
Yeah. It's quick. I don't know if you're comfortable actually answering this question, but how old were you when you got diagnosed?
Which as a gal was 17 with spondyloarthritis. I mean, I was suffering with that for quite a long time. I think it was around 28, 29 when I
Got it.
got
Okay.
diagnosed.
Okay. Cool.
Yeah.
Yeah. So, Micah, one of the things I noticed on your Instagram page is that you write that the impact you want to make is by giving a voice to invisible diseases. What does that exactly mean by when you say invisible diseases?
Yeah, great question. So autoimmune disease, you can't really see it usually unless it's on the skin. And there's a lot of patients out there that are suffering.
Mhm.
They look great on the outside, but inside they're hurting. So I mean, with joint pain, you can get swollen joints, but if you're not a doctor, you probably won't notice that someone's having swollen joints that day or they're in pain. Patients can have like for example, lupus can attack any organ of the body.
Mm-hmm.
You can have lupus nephritis of the kidneys. You can have lupus of the lungs. You can have even autoimmune disease attacking the lungs, interstitial lung disease as well. You can't see those things. You can't see someone that's short of breath. You can't see someone that is having a kidney attack, that's having brain fog, thyroid disease. You don't see patients that are having hypothyroidism, having issues that day, being tired endlessly, having morning stiffness. These are things that these patients look and talk like they're normal, just like
Mm-hmm.
everybody else in the population that's healthy with nothing going on. But really, they're hurting inside. They can't function. They're losing jobs. They're going on disability. So I'm just trying to give a voice to these diseases so that these patients can be heard. Because what I'm doing is I'm trying to bring in integrative medicine and the fact that there's so many ways to heal these diseases, not just throwing medications that we are traditionally trained in.
Mm-hmm.
And patients are looking for something like this, and I was a patient that was looking for something like this. That's why I'm so passionate about it.
Absolutely. I mean, I think, in the last decade or so, autoimmunity has been this pretty hot topic, right? That people are looking more for getting away from these pretty hard medications on the body, looking for a more natural approach, which is why, again, you just mentioned that you're going down this integrative functional lifestyle pathway. So is it that autoimmune diseases have been on the rise, or is it that, the prevalence has always been there? It's just that the fact that we're now unmasking those symptoms and we're better aware at what autoimmune disease looks like.
Yeah, I mean, technology has definitely gone better over the past several decades. So yeah, we're better at detecting diseases.
Yeah.
There was a paper I'm always quoting of the International Journal of, I think, Celiac Disease. They were talking about how there's a rise of autoimmune diseases, and across all spectrums, neurologic, endocrine, GI, rheumatology, there is a rise of about 7 to 10% a year in these diseases, and that really doesn't surprise me. Our food is getting more processed. There's more pollution. So I think, yeah, our detection rate is getting better because of technology. But at the same time, it's not all because of technology. It is also because of the way we live, the food, the environment. Everything is playing a role in this, the rising rates.
Yeah, absolutely. And I really want to delve into your kind of integrative experience, your functional medicine experience. And you just said one thing with food being more processed. How much of a role are diets playing? We know that there's so much food having pesticide on it, even organic, right? Will have like trace amounts of pesticide on it. How much of that's actually playing a role in terms of these flare-ups or having people start up with autoimmune disease?
Yeah, I don't have a number for it. I don't think there's any studies
Okay.
out there that can say there's a number on this, but definitely, I
Sure.
think food is definitely playing a role. Before we even get to the pesticide part, I think just the fact that people are eating processed food in general is
Mhm.
so bad. You got your fast food, you got chips, you got cookies, and all these different things. The way we're raising animals doesn't really help either. What we're feeding the animals. So all these things are pretty much throwing inflammation at the body, left and right.
Mhm.
So if you have the right genetic factors, you're gonna flare up with some autoimmune disease. And with the pesticides, I mean, there are studies out there that just being around pesticides, having it sprayed around your home or living on a farm, even the worst part is working on with pesticides directly does contribute to rise higher incidence of lupus and rheumatoid arthritis. They are in prominent journals that we've talked about, but of course we don't talk about it in academic medicine because what are we going to do with it, right? There's no medication to throw against pesticides.
Yeah, no, I mean, I think that that's a really important point, though. I guess, you know, I'm always interested, I think from an academic standpoint, this is a really interesting discussion, right? But I always want to know, and the people closest to me in my inner circles always want to ask me questions about, well, what do I do with this information, right? Because that's what really matters at the end of the day. And you've spoken about how you're an advocate and we're trying to make an impact, right? So the question for you is, when you see these types of patients in clinic, what's your approach, right? I mean, I think that for me personally, if we're talking about the pesticides, I can see the role and how they can have an adverse effect when it comes to these diseases. However, I also look at it from like how significant is that, right? Versus
Right,
when we're talking about eating Cheetos all day, every day, right? So to
right,
me, it just becomes, are we majoring in the minors there, right?
right, right,
So
right.
So the question for you is like when you're seeing these patients and they have a clear diagnosis, right? We've gone through that. We've got all the things. There's no doubt in your mind. What's your approach to kind of helping overhaul the diet or make adjustments to the diet, however you do it?
Yeah. So for the diet, I go over the most obvious inflammatory foods, which are red and processed meats, your fast food, your chips, all these things, highly processed. Those are the main things I try to cut out. High salt diets, refined sugar. These are the main components that I focus on. And then we talk about organic food, right? So main thing is getting the fruits and vegetables, whether it's organic or non-organic. Like you got to get it in. I would rather have you eat a non-organic, um, pesticide filled with pesticide apple rather than go to McDonald's down the street, right? So I think that's the main thing here. That's the main message, to get those fruits and vegetables. I don't care how you get it in, whether it's organic or not. If you can afford organic, great. If you can't, then it's no big deal. That's that it might contribute to the disease, but overall you got to get the foundation right. Because if you don't get the foundation right, like you can eat all the organic all you want, but you're still gonna be flaring.
Right. So having a or something off the dirty dozen like is okay versus having an organic Twinkie. Is that what I'm hearing
Exactly.
from you?
Exactly. I'm very practical in my approach.
Yeah. So, I mean, how do you do that? Is that something that you're kind of taking all on your plate, or do you have a team? Do you have a nutritionist, dietitian in your practice?
No, it's me.
Gotcha.
so
One man
so
show.
my model of healthcare is very different. That's why I went to private practice.
Hmm.
That's why I didn't stay with any organization or go into academic medicine. Because if you do that, you're seeing patients every 15 minutes, right? Every 20 minutes, and it's
Yeah.
a door medicine. And all you're doing is throwing medications at patients without really giving them counsel on what a proper lifestyle is. So I spend 1 hour on new visits, half an hour on follow-ups. And I got out of the insurance model so that I can do this kind of healthcare, where I spend a whole hour counseling patients. First of all, I go over the symptoms, diagnosis, medications, and then I go over all these other components that are very important. It's all about education here. Patients are not educated properly. There's so much misinformation on the internet. You got people that are not even qualified to give advice on the internet that are giving the wrong advice. So the internet is a very, very scary place if you're looking on the wrong places.
Exactly.
Um, as a rheumatologist, I mean, I've had the training already, and I'm bringing the wellness space to patients as well with scientific evidence here. And I think that's important, is to bring in the science to it, because some people, they just make up stuff on the internet, and it's dangerous when they do that.
Right. There's no internet police out there, right? And this is what's good about it. What people don't understand is, I mean, we can kind of spend a whole couple of hours talking about even the errors in even evidence-based medicine and issues with different types of journals and whatnot. But at least most journal articles and publications that you're going to find in PubMed, there is somebody out there, editors that are reviewing the work, right? The credibility of some journals, again, that's a different discussion in its entirety. But anybody going on just blogs and this and that kind of information can put anything. Nobody's out there editing and policing that type of stuff. So, which is why every time somebody comes to me and says, well, what do you think about this? And I have to ask, why? Like, why does that matter? Like, why is that important to you? Or why is that a question that you're even asking? I even have to ask that, and they're like, oh, well, I read this and I did my research here. And I was like, well, what does that mean? Like, what kind of research? What's your reference? And we talk about that. But I want to we took a zoomed out approach of okay, how do we address that kind of stuff in your diet? And that's probably nothing new for anybody who's listened to our last couple of episodes. We've kind of spoken at length about why that's important. So I'd like to zoom in a little bit more now, right? Specifically, let's just take rheumatoid arthritis. I think that for us, we're both physiatrists. Something we see is highly prevalent now is obviously osteoarthritis, right? It's more of a degenerative condition. And like, if you live long enough and you put enough mileage on your body, 100% of people are going to get that. There's just no getting away from that. Rheumatoid arthritis is a little bit different though. So maybe you could kind of explain how that differs from osteoarthritis, like which is more of considered a wear and tear. And then specifically, how might, in terms of like mechanistically, a plant-based diet help, at a systemic level with that disease? just so people
Yeah.
have some perspective.
Yeah, so rheumatoid arthritis is an autoimmune disease that attacks the joints. It's different from osteoarthritis because osteoarthritis is more wear and tear. There is inflammation at the level of the joint, but not systemic inflammation. Osteoarthritis will not give you eye inflammation, all these different things. Since rheumatoid arthritis, people think it's just joints, but it's also eye. You can get blind from it. You get eye inflammation. You get interstitial lung disease. You can get heart attacks from rheumatoid arthritis. There's so many things. You can get vasculitis from rheumatoid arthritis as well. It's similar to lupus where it attacks a lot of different organs. Just a different manifestation of it. So I've seen patients die from rheumatoid arthritis before. That's why we work with so many different specialists on rheumatoid arthritis. And in rheumatoid arthritis, a plant-based diet can help because there is gut dysbiosis. So I'm sure you've had many podcast episodes talking about gut health already. Gut health is tied directly in with the immune system. 67% of the immune system is located at the gut in the Peyer's patches. That's something that we tend to forget after medical school. And so every time you eat food, it touches the immune system in some shape or form. And so there are two types of T cells that are very, very important out there. There's T regulatory cells, which are anti-inflammatory, and your T helper 7 T cells are pro-inflammatory. So with many autoimmune diseases, your T regulatory cells will be depleted or very low. T regulatory cells are their main function. One of the main functions is to basically, if you remember from medical school, is to pretty much, if you're fighting an infection, you want that. When you're done fighting the infection, the virus or bacteria, you want it to stop fighting, right? Or else you're overfighting or stimulating your immune system too much. So that's what Tregs do, T regulatory cells. With autoimmune diseases in the immune system, what it does is it helps your body tolerate the immune system. So it helps with immune tolerance. So with autoimmune disease, you lose immune tolerance. So pretty much your immune system is supposed to recognize its own cells so it doesn't attack itself, right? And that's what T regulatory cells do. It helps it recognize itself so it stops attacking its own body. But when it's down and low, your body will keep attacking itself. And when you eat a plant-based diet full of fiber and phytonutrients, it actually upregulates T regulatory cells at the level of the gut. And it actually downregulates T helper 17 cells. It's a seesaw effect. And it also this effect at the level of the gut will go through the circulation system, the lymphoid system, and it will pass the signals on eventually to the level of the joint, which is the gut joint axis. And this is generated through short-chain fatty acids, which I'm sure you've heard of time and time again on your podcasts. Short-chain fatty acids, butyrate, propionate, acetate, are generated from fiber from the gut, from gut bacteria. So when you generate short-chain fatty acids, that will upregulate T regulatory cells, which then upregulate the anti-inflammatory cytokines out there. And we eat inflammatory foods that will increase T helper 17 cells, which will then upregulate pro-inflammatory cytokine, interleukin 17, and various other inflammatory cytokines. This is why food is so important. It's not the end-all be-all of all diseases, but it's a major foundation to how we attack these autoimmune diseases from an integrative standpoint.
Yeah, absolutely. I mean, that was a great recap of the immune system, right? And like I said offline, Micah, we had Dr. B, right? Will Bolsowich, the gut health MD, kind of come on to our podcast here and talk about leaky gut, right? Which is kind of essentially what you're talking about here, where food can escape the gut lining, and then our body sees that as a foreign object and says, "Hey, we need to attack this antigen," right? So let's talk about kind of like the therapies of food, right? So we know that, like you said, plant-based can be helpful for some people, right? So we know food's an important part. What are your thoughts on fasting and gut health? How has that played a role, if any, in some of your patients?
Yeah, so fasting, there is, I don't know if you saw the New England Journal of Medicine article about a year or two ago on fasting and overall health. Fasting does have an anti-inflammatory component to it. It's not bogus quackery medicine like some people think. So fasting, actually great backgrounds of this. So fasting does have anti-inflammatory component for the immune system. It does downregulate mTOR. mTOR, when you it does upregulate, I think, beta hydroxybutyrate, which is upregulated in DKA, as you remember. So beta hydroxybutyrate is actually anti-inflammatory. So when you fast, upregulates that pathway, and it does then upregulate T regulatory cells again, which are anti-inflammatory. So when you eat, it's okay, but when you eat too much, it keeps turning on mTOR, and that will turn on the T helper 17 cells. You want to activate mTOR because it builds up the cells. You need it to build cells, but you don't want to be activated all the time. So when you do fast, you give your body a break, and you do give your body an anti-inflammatory effect with the T regulatory cells. And that's where the foundation is. I mean, they've tried to produce medications for this already on mTOR, but nothing has been used yet that we can safely use in rheumatology.
Sure.
The mTOR molecular target rapamycin. That's what it stands for. There's some medications that are out there, but nothing for rheumatology yet. But that's where it's at. I don't know about the gut health details of fasting. I think it probably actually I don't have an answer for you. I don't remember the literature on that.
Sure. No, that's completely fine.
I mean, that's totally cool. And I think for a lot of those individuals who might have read that paper, or if you didn't, I think in a more simplistic layman's terms, that's kind of what you're talking about is ketosis, right? At a certain point, you're going to be in ketosis, and that's where the
exactly ketosis. Yep. And then that Nature Review did a great article on this too, mTOR and rheumatology. So there's a lot of legit papers out there on integrative medicine that people don't see, and that's. I think we're gonna get to this point too. There's so many traditional doctors that attack integrative medicine, and it's because of they don't understand. They haven't seen the science yet behind it, and we can get to that point later on.
Yeah. When was that? Just curious in Nature. When was that paper published?
Probably in the past 3 years.
Okay. All right.
Yeah,
I got to check that out for sure.
You just email me.
Yeah, absolutely. So, this kind of begs the question over the past year, obviously in this pandemic. Again, I've said it before. I'll say it again. In my lifetime, arguably like the craziest thing that we as a society on a global level that we've been through, right? And we've all kind of suffered and struggled through this together, where stress is at an all-time high. You eloquently described the role of T helper cells, T regulatory cells with, the immune response with respect to autoimmune and attacking its own body. COVID, we know that, T cells have a pretty influential role when it comes to viruses in our body as well, right? From both innate and acquired immunity type stuff. So one of the things to set off these autoimmune conditions a lot of times, and please correct me if I'm wrong, are like these times of acute stressors, right? Mm-hmm. Or, subacute to chronic stressors that people, it'll set something, whether it's like just excessive sleep deprivation for a lot of people, it's medical school, having a new child, that kind of stuff. So again, just COVID going back to being this global stressor. Understanding that this might be purely anecdotal in your practice, I'm wondering if you have seen a rise of autoimmune diseases or certain types of diagnoses more so than other over the past year.
Mm-hmm. I don't think I've seen a specific rise in certain diagnoses, but going back to it, viruses, like you said, COVID can give you a new autoimmune disease. We know in literature that viruses are a root cause of autoimmune disease, EBV, CMV, different viruses, COVID. I've seen new onset rheumatoid arthritis, lupus from getting COVID. And as far as acute stressors, they are a root cause of autoimmune disease as well. There's something called psychoneuroimmunology that not many people talk about, that connects the brain, stress, sleep, to autoimmune disease and the immune system. So it's out there. It is a known trigger. And that's something that, like, us traditional medicine doctors, we don't really talk about much. But if you go into integrative medicine, functional medicine, they do talk about these type of stressors and viruses out there.
Psychoneuroimmunology, that's next level stuff, man.
It's out there in the immunology literature. It's quite exciting stuff, but unfortunately, we don't talk about it enough.
Yeah, I mean, we don't have time to talk about nutrition. I'm not really sure where we're going to fit that into the curriculum.
Yeah, maybe in the future.
Yeah.
Micah, I wanted to shift gears here a little bit because I think this is somewhat of an important topic because, again, in the last decade, a lot of people have been talking about that, and that's pollution, mold toxicity, right? You're from California. Pollution's rampant over there, right? LA and things. But also this concept of mold toxicity. I'm seeing a lot of naturopathic doctors, functional medicine doctors as well, talk about how mold can silently, be quote unquote killing us as well. I know you've touched about this a little bit on your Instagram post. Can you take us through some of these environmental exposures and maybe, what are those symptoms that humans might feel, but also what are those red flags that we should be looking for maybe in our environment?
Yeah, so environmental toxins is something that's legitimate. A lot of people will, traditional doctors will talk bad about environmental toxins, saying they don't exist, but they do
Mm-hmm.
exist. There's a prominent prominent paper in Nature Reviews Immunology that talks about environmental toxins and detoxification, which is another
Mm-hmm.
buzzword that a lot of people on doctors on social media attack. But detoxification actually exists. Functional medicine actually talks about it. And it's so some of these environmental toxins are BPA, plastics, phthalates. What else is there? There is PFAS. So water source is a source of
Mm-hmm.
environmental toxins. Your makeup, your Teflon, your like I said, your heavy metals also in the environment, arsenic, mercury. These are environmental toxins too. There's so many things out there. Your flame retardants are also a source of environmental toxins. And my integrated medicine fellowship talks about this as well. And you can actually detox these things. Sweating is one form of way, in sauna or exercising to get rid of it. There's other ways out there. There's supplements that can help you as well. So some of the things you can manifest. You can definitely, I think it contributes to autoimmune disease.
Mm-hmm.
There is a pathway, but I mean, we're at the beginning of research here. There's nothing that is conclusive yet. Um, but you can manifest brain fog, fatigue, you get some joint pain, thyroid disease symptoms. There's so many. It's very non-specific how these symptoms can manifest, and I don't think there's enough literature to say that you're gonna get these specific diseases. I think everyone's genetics, epigenetics are different. So time will tell once research comes out in the next 2 decades or so.
Mike, I want us to be a little bit more clear, so just because there might be some people listening, and because I've been a part of this where we're talking, and people say, "Well, I'm doing a detox diet." Again, I can certainly appreciate it, and I couldn't agree more in terms of our body does a phenomenal job, and we have organs that are designed just for detoxification purposes, right? And we've got liver that does a tremendous job at that, or our kidneys do a tremendous job at that, and certainly with sweating, we know sauna, some of the therapeutic benefits are because of what you're talking about. I know Dr. Rhonda Patrick's talked at length about that, and it's been very informative. But what you're not suggesting, just so we're clear, is like, detox diets. Is that something that you think has merit? Because I mean, people will market that, like, let's do this 7-day juice detox diet and you will be rid of all these toxins and your life will change. Is that what we're talking about? Or
Yeah, so I don't do any specific detox diet. I believe in a detox lifestyle, not so much a
okay,
detox diet. So detox diet, I mean, really is just fruits and vegetables and fiber, right? That will
yeah,
grab the basics here. That will fight um the environmental toxins. There is a scientific pathway to that, how we'll fight it. So it's more about your lifestyle than just eating right for 7 days, whatever that
right,
detox diet would be. There's no detox juicing. There's no detox diet. I think this is a buzzword for marketing to sell stuff,
yeah,
but scientific detox does exist.
gotcha.
Yeah, absolutely. I think that's a great point that you mentioned, and a very clear distinction because again, I think a lot of people get caught up in this marketing term saying, "Oh, detox, I need to get on that." Right? They dish out $500 and nothing's really changed. Maybe they feel great for 3 days, they're back to where they are. But talk about environmental exposures in your patients. Is there anything that at least prompts you to ask those questions to your patients? Is there anything specific where you're saying, let me ask this now because this might be a reason as to why?
It's actually part of my HMP. It's part of
Okay.
my visit. So I ask it automatically. I have fill a questionnaire. It's in my follow up visits too.
Gotcha. Okay.
Yeah.
All
So
right.
it's nothing. It's not. Yeah. There's nothing where it prompts you to ask these. I ask it automatically.
Okay, gotcha. And then keeping on this topic of environment, right? I know you're really into grounding or like getting in touch with nature. How does that really help us?
Yeah, yeah. So I haven't looked into literature and grounding, but I'm sure it helps. But I mean, there was a paper in so I think I was out of Japan. I think there are other papers as well where they went to a forest for like a couple of days or a week, and it did help with their immune system. I forgot. I haven't looked at that paper for at least 6 months to a year, so I don't remember the details. But it is out there. You just type in what was it, forest bathing. Look up forest bathing and immune system. I'm sure. Have you guys talked about this in your podcast already?
No, we haven't, but it's actually it's quite famous out there, and it's quite talked about. I mean, they call it Shinrun Yoku. It's a concept of forest
Yeah,
bathing to help
Hmm.
reduce stress and promote. And it's
yeah.
actually my favorite way to meditate. I know that Darsh and I are always talking about how do we implement mindfulness in our practice on a daily basis, and something that I haven't quite skillfully adapted as much as Darsh has in his daily right. But for me, not to kind of interject and go off on tangent here. For me, the way to do that is to go on a walk through a
Mhm,
forest type stuff.
mhm.
So yeah, it's just very much so. But I'm pretty sure that I know what you're talking about. The
Yeah,
article, we'll find it.
Is that what
yeah,
it is
yeah,
though?
yeah.
Yeah,
That's what it
yeah, it
is.
is.
Oh
Yeah,
wow. Okay.
Yeah, you have to get away from the city because they did two groups. They did one that stayed in the city, another one that was actually in the forest, nothing else, right? No pollution, nothing. And they looked at the cortisol level. They looked at other levels as well, and it's also the essential oils from the trees also contributes to that as well. Aromatherapy can be pretty helpful as well. That's part of integrative medicine, essential oils.
Very cool. Okay, yeah, I never knew that. I mean, I love going out in nature, but having that distinction of getting actually out of the city and literally bathing in the forest sounds pretty awesome
Yeah,
because
like
you're
going to
bathing in
national
those
park.
oils, right? Yeah.
Yeah,
Very
yeah.
cool.
yeah. I mean, I literally did a quick search in PubMed right now, and there's quite a few articles. I mean, the most recent one, I'm looking at this Shinrin Yoku Forest Bathing and Nature Therapy, a state-of-the-art review. This was published in the International Journal of Environmental Public Health in 2017. First author is, oh man, I'm going to ruin this name. But anyways, it's there. We'll link in the show notes for people
Yeah,
to
it's been
see.
recommended
But
a
yeah,
couple times. It's not too
yeah,
long.
yeah, it's definitely been talked about quite a bit. And, I mean, it always goes back to, again, we talk about this concept of, literature looking at the masses in terms of what teams to work, but then also, if there's not a lot of harm to be able to do it, understanding there's an opportunity cost for everything, just try it. Try it and see whether it works or not, right?
Yeah, I mean, going to the
um
forest is harmless.
yeah, well, yeah.
Unless
Well,
you
it
get
depends
eaten
on the
by a
forest,
bear.
right? So, I want to ask you a little bit more here. I know we're a little short on time. You mentioned the whole integrative approach and how a lot of quote unquote traditional doctors will seem to dismiss it, right? And all these things, whether we're talking about toxins, whether we're talking about forest bathing, honestly, and really nutrition, although they're less likely to do that. I think that that's just of more of an ignorance thing. They don't really understand it, and so it's like we're not going to worry about that, and that's understandable. We don't learn about that. We're not educated on that. But what inspired you to even kind of go down this path of integrative medicine? You're doing your second fellowship now, right? And as I understand it, rheumatology is 2-year fellowship. Is that correct?
Rheumatology is 2 years.
Yeah.
Took my boards in lifestyle medicine during fellowship. So now, yeah,
Wow. Okay.
2 years in integrative medicine. And really, it's because of my own disease. I
Yeah.
found a way to help myself, and I want to now help people because, going on medications is one of the answers, but it's not the only answer. And
Hmm.
there's always side effects with medications, right? People are taking statins like it's candy, but there are side effects to it. And I mean, you can get myositis from necrotizing myositis from statins. It's rare. But as a rheumatologist, I see it a couple of times already. And it's one of the worst forms of myositis out there. It's an autoimmune disease. So medications have its role, but it's not the only form of healing in medicine. And unfortunately, I think that because we spent so much time as MDs and DOs learning about medicine that we think that it's the only form and it's the only truth out there, which I don't think that's true. I think there's so many other ways that can be beneficial to helping patients. And that's what I'm trying to explore here. I'm trying to have a global view here. I mean, naturopaths have their own way of medicine. We also do too. I don't think everything that they're doing is wrong. And we're always attacking naturopaths. Naturopaths are attacking us. But I think there is some middle ground here. I think that medications have its role, and natural medicine has its role too. And I want to just blend both fields and give the best, whatever the patient's goal is, and that's what I want to work towards.
As my counterpart here said in a recent talk, your truth is ever evolving. Is that right, Darsh? Yeah, no, it's such a thing that I struggle with, because we always want good versus evil. We want bad versus good. We all want team naturopath, team MD or DO, or team chiropractor versus team osteopath, and it's just like, we could work together. We all have, most of the time, we all have the same goal, right? And I imagine you're not anti immunotherapy. Like if somebody's coming in and they're in excruciating pain, you're not going to say, well, let's give you an apple, right? Like,
Yeah,
so
exactly.
everything has a rule and it's a tool in their tool belt, right?
Yeah, exactly. It's adding tools to the toolbox. That's exactly what it is.
Yeah. So, I mean, that is, we're on board with that. That's exactly how we love to practice. And that's what we like learning about. And so, I know you've been doing a lot of great things. We've been following you, and it's great to connect with you. And we'd love to kind of have you back, and so we can dive a little bit deeper into all the great things that you're doing, and pick your brain a little bit. But what's next for you? What are you excited about in the near future? What's coming for you? What are you planning?
Yeah. I mean, I'm trying to continue growing my private practice, and just finish up. I've been so strong. I work 7 days a week. I Either if I'm not working in the hospital or seeing patients, I am working my social media. I'm studying. So medicine is lifelong. So I'm just trying to figure out this all out. I mean, there's no mentors for me out here. I am my own mentor. I'm trying to pioneer the space. I don't think there's any rheumatologist that has combined functional, integrative, and lifestyle medicine all in one and trying to give an answer. And I'm trying to just figure out what's real and what's not. There's a lot of hocus pocus in the internet too, right? When you learn stuff. Because I'm learning functional medicine, but as an MD, I'm trying to figure out what's real and what's not. I mean, there's some stuff on functional medicine that doesn't have much evidence, and there's stuff that does. And I that's where I'm trying to do here. I'm trying to figure it all out. I'm trying to go on YouTube space. I want to write a book in the future on just figuring this all out for people. I don't think a rheumatologist has written a book like this yet. So there's definitely from other people, but no one that has specialized in autoimmune disease.
I love it, Micah. That's truly inspirational, and I want to say thank you for coming on here, and sharing your knowledge. I follow you on Instagram. It's truly motivational to see someone like you who's gone through their own pathology and now trying to make that impact, as you said, and give a voice to people who can have a tough time, with these really terrible and struggling diseases. So thank you so much for having a growth mindset. And I think you just said it, right? It's about finding the truth, and it's about us doing our homework and trying to integrate all three of those fields: lifestyle, functional, and integrative medicine, and kind of seeing what that balance we can strike is. And again, what helps the patient the most. But before we end here, I also do want to ask you, where can people find you?
Yeah, my social media handle is myautoimmunemd. So you can also go to myautoimmunemd.com, and that's where my personal website is. You can find me on Instagram, TikTok, Facebook, Twitter, LinkedIn. And if you want to find me as a doctor, go to drlifestyle.org, drlifestyle.org. That's where me and my wife practice. My wife is a family medicine doctor doing the same thing here. I'm just doing the autoimmune side of things. So that's where you can find me. It's and if you follow me, I mean, there's a lot of growing and learning on my end. So it's always passed down through my social media.
Awesome. Very cool. And last question for you here that we ask all our guests: how do we put the health back in healthcare?
Let's see. First, we need to change the model of healthcare. First, we need to put the put the.
You have 1 minute to answer this question, Micah. No.
Yeah. Put the power back into the doctors instead of the healthcare administrators. And that's where it is. I think as doctors, we're doing a great job, but we've lost our control over medicine, and we've lost it to the healthcare administrators. So we need to take that back, so that we can spend the extra time that we need with patients without being pressured from above. if you're working for somebody. But if you're in private practice, you can do whatever the hell you want. Like, so that's the way to put the health back in healthcare. That's the first step. Because without that, you can learn all the nutrition stuff you want, but you're never going to be able to implement that into your practice.
That's true. That is wisdom at its finest. Well, Micah, thank you so much again for joining us today.
Thank you, Micah.
Thank you for having me. It's on.
I hope you all enjoyed that episode with Dr. Yu. I mean, I just can't wait to bring him on for another deeper session, especially when he gets that trifecta of lifestyle medicine, integrative medicine, and then functional medicine. And then with all those three, he's going to have so much knowledge and can really attack rheumatology from any angle. And he's going to have so much knowledge. And that's what I love about Dr. Yu. He's just on this quest for helping his patients with as much knowledge as he can and really sift through the evidence to see how he can individualize care. And now many of you guys might have questions about COVID and autoimmunity. And, by the time we did this episode, a lot more has come out. So I highly recommend checking out his Instagram page, which is at myautoimmunemd. And over there, Dr. Yu is doing Instagram lives, he's putting out posts, and he's sifting through the information for you. So I could not recommend it more. And one last thing before we go, remember Advice Media. Don't forget to schedule a consult with them to receive a $60 gift card and strategic insight on what your current digital marketing is doing or not doing for you. Contact Advice Media at drpodcastnetwork.com/advice media. Again, that's drpodcastnetwork.com/advice media. Quick disclaimer, everything in this podcast is for educational purposes only. It does not constitute the practice of medicine, and we are not providing medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of your personal physician regarding any specific health-related issues. And until next time, please rate, review, subscribe, and share. Thank you.